All right, let's get right into it. If you're getting ready for your anatomy exams, you know there are some topics that are just pure high-yield gold. And guess what? The mediastinum is right at the top of that list. So in this guide, we're going to break it all down. We're going to build a super clear, easy-to-remember mental map of this whole area, so when you see it on your exam, you'll absolutely nail it. Ready? Let's go.
So let's start with a question. Forget the textbooks for just a second. What do you think is the busiest, most critical piece of real estate in your entire chest? I mean, we're talking prime property here. It's not the lungs. Nope, it's actually the space between them. Think of it like a central highway, this packed corridor that holds all the super important stuff that keeps you ticking. And that corridor, well, that's the mediastinum.
Okay, here's how we're going to tackle this. First, we'll lay out the blueprint, define the space. Then we'll talk about the Great Divide, the Sternal Angle. After that, we're exploring the rooms, checking out what's inside. We'll also cover the clinical red flags you gotta know, and wrap it all up with a killer exam pro tip. Let's get started.
All right, first up, the blueprint. It's simple, right? Before we start putting furniture in a house, we need to know where the walls are. So let's define the actual space of the mediastinum.
So, what are we actually talking about here? The fancy definition is the median septum of the thoracic cavity. But let's make that real. Picture your two lungs, right? Each one is sitting in its own little bag, the pleural sac. The mediastinum is basically everything else. It's all the crucial stuff packed right in the middle, between those two sacs.
Now listen up, because this is pure exam fodder. You have to know the boundaries. The best way to remember this is to think of it as a box. Seriously, just picture a box in the middle of your chest. The roof, that's the thoracic inlet, the hole at the top of your rib cage. The floor, that's your diaphragm. The front wall is your breastbone, the sternum. The back wall, that's all your thoracic vertebrae, T1 through T12. And the side walls, well, those are just the shiny linings of the lungs, the mediastinal pleura. A box. Easy, right?
Okay, moving on. And I'm not kidding, this next part is the key. It's the secret that makes understanding the mediastinum so much easier. If you only remember one concept, make it this one. We're talking about the Great Divide, all thanks to the sternal angle.
It's kind of crazy when you think about it. This whole complicated space, just jam-packed with pipes and wires and the heart itself, it's all organized by one single imaginary line. That's it. And for your exams, understanding this line isn't optional. It's everything.
And here's that line. It's a horizontal plane that runs from an anterior point to a posterior point. Up front, you've got the sternal angle, also called the angle of Louis. You can actually feel it on yourself. It's that little bump on your sternum. That line goes straight back to the lower edge of your T4 vertebra. That's it. Everything above that line is the superior mediastinum. Everything below is the inferior mediastinum. Seriously, tattoo this on your brain. The T4 plane is your master key to this whole region.
All right, so we've got our floor plan, we've divided the house into an upstairs and a downstairs. Now let's actually go explore the rooms and see what's inside. Let's talk about the contents.
First, let's head upstairs to the superior mediastinum. This is everything that's sitting above that critical T4 plane we just talked about. And wow, this place is crowded. Think of it as a major intersection. You've got the huge arch of the aorta and all its great vessels branching off. You have the trachea, which is your main airway, and right behind it, the esophagus, your food tube. Plus, it's a superhighway for nerves, like the vagus and phrenic nerves, and even the thoracic duct. It's a real busy neighborhood up here.
Okay, let's go downstairs now, below that T4 plane, to the inferior mediastinum. And this is really, well, it's the heart of the matter. This section is so important, it's split into 3 smaller compartments, and one of them is the absolute VIP.
And here it is, the main event, the middle mediastinum. I mean, this is it. It contains the heart, wrapped up in its protective sac, the pericardium. It's also got the big vessels right as they leave the heart, the ascending aorta, and the pulmonary trunk. The phrenic nerves are hanging out there too. So if you get an exam question asking what's in the middle mediastinum, the answer is just the heart and its posse. Simple as that.
So what about the other 2 rooms down here? They're way simpler. The anterior part, the one in front of the heart, is pretty empty. It's just got some ligaments and maybe some leftover thymus tissue. Then you have the posterior part, behind the heart. This is basically another hallway for things heading down to the abdomen, like the descending aorta and the esophagus.
Okay, we've got the map. We know the anatomy. So what? Why does any of this matter? Well, this is where it gets real. Because this space is so tightly packed, when something goes wrong, like a tumor starts growing, it's going to push on things, and that causes very specific, very predictable problems.
let's talk about the clinical red flags.
First up is something called mediastinal syndrome. Now, this isn't a single disease. Think of it more as a collection of symptoms, a syndrome, that happens when stuff in the mediastinum gets compressed. Usually it's a tumor or some swollen lymph nodes causing all the trouble.
And this is beautiful because the symptoms link directly back to the anatomy we just learned. It makes perfect sense. If you squeeze the trachea, what happens? You can't breathe well, breathlessness. If you press on the esophagus, you have a hard time swallowing, which we call dysphagia. And what if you compress that left recurrent laryngeal nerve? Your voice gets hoarse. See? It's all cause and effect. And trust me, examiners love asking about these connections.
Here's another big one. Superior vena cava obstruction, or SVC obstruction. Think about it. If you block the main vein draining blood from your head, neck, and arms, where's that blood going to go? It can't, so it backs up. And what you see is a classic picture, a puffy, swollen face, and these big, dilated veins popping out on the chest wall. The body is desperately trying to find a detour for all that trapped blood.
And last but definitely not least, mediastinal shift. This one is a flat-out, sirens blaring medical emergency. Imagine one side of the chest fills up with a ton of air or fluid. There's so much pressure that it literally shoves the entire mediastinum, your heart, your trachea, everything, over to the opposite side. This is a catastrophic, life-threatening situation, and you have got to be able to spot it.
Okay, let's wrap this up. I want to give you one final pro tip. This is the thing that ties it all together and is going to score you some serious points on your exam. Here it is, straight from the source. Examiners are obsessed with the relationship between the sternal angle and the T4 vertebra. Why? Because that T4 plane is where everything happens. It's where the trachea bifurcates. It marks the beginning and the end of the aortic arch. It's the line that divides the superior from the inferior mediastinum. So my advice, master the T4 plane. If you can list all the anatomical events that happen at that level, you are absolutely golden.
So there you have it. You've got the complete map. You know what's in all the rooms. So I'll leave you with this final thought question to chew on. With all that critical stuff packed in there so tightly, if you had to pick just one structure to compress, which one would give you the most dramatic, the most immediate, the most life-threatening symptoms? Really think about it. That's the kind of thinking that turns you from someone who knows anatomy into someone who can use it. Okay, that's it for now. Go crush those exams.